Sleep disorders are associated with increased cancer risk, particularly hormone-dependent cancer. The prevalence of sleeping disorders has increased worldwide and can be attributed to a contemporary lifestyle. The risk of developing cancer was found to be 5 times higher in developed countries where societies are more active during the night and thus significantly more exposed to light. Studies found that night shift workers, such as nurses, have increased risk of breast and prostate cancer.
I'm going to explain what a normal healthy sleeping cycle, also called circadian cycle, looks like. In order for that, I'll explain the different stages of sleep. Sleep stages are defined primarily based on the measurement of electrical activity in the brain using an electroencephalogram or EEG. The sleep of most mammals is divided into two fundamental patterns: rapid eye movement, REM, and non-rapid eye movement, non-REM sleep. There's a division into 4 different stages of sleep. Stage 1 is the beginning of sleep, the lightest stage of sleep with low amplitude and high frequency waves. Stage 2 is characterized by the presence of phenomena on an EEG known as sleep spindles, very high intensity waves, and K complexes, which represents a biphasic wave which stands out on the EEG. Stage 3 sleep is called slow wave sleep or deep sleep and is especially important for overall restfulness, characterized by low frequency, high amplitude waves. REM sleep, also called rapid eye movement sleep, and during this phase, the EEG activity resembles waking activity. The muscles are completely relaxed and limp, but the eyes move rapidly. It is a time of sleep where the most vivid dreams are likely to occur. Most people will repeat this cycle 4 to 5 times a night on average, with each cycle lasting around 90 to 110 minutes.
Disruptions in this pattern causes disruption in the different physiological processes regulated during sleep, including hormone production. For example, cortisol levels in the body increase when the individual is deprived of REM sleep but experiences more episodes of light sleep, stage 1, and intermittent wakefulness. Cortisol is a hormone which suppresses the immune defenses and thus our body's capacity to kill cancer cells.
At the center of the relationship between sleep and cancer lies melatonin, a steroid hormone secreted by the pineal gland located in the brain. It is mainly produced at night during sleep due to the absence of light, and it induces sleep in accordance with our circadian rhythms explained before. Most importantly, melatonin has tumor suppressive effects. Evolution ensured that when light enters the eye, the brain would receive the message, "It's daytime, let's be active." However, while optimal for our ancestors, there is a mismatch between this mechanism and modern lifestyle. Sleeping during daytime and prolonged light exposure at night result in suppression of nocturnal melatonin production, which increases the risk of cancer.
Melatonin's anti-cancer action is attributed to mechanisms based in protein encoding. Those mechanisms include counteracting inflammatory responses, protecting the integrity of cellular chemistry and DNA through redox reactions, which prevent free radical formations. Free radicals cause mutations, and therefore the prevention of these enhances resistance to oxidative and cellular damage. Melatonin sends signals to cells and organs within the body to organize themselves, inducing a homeostatic metabolic rhythm. The hormone controls the metabolism of substances, such as linoleic acid, which promote cancer cells' development. Melatonin also exerts anti-proliferative effects, inducing apoptosis, inhibiting blood vessel formation in breast, prostate, and ovarian cancers. Sexual hormones, namely estrogens, progesterone, and testosterone, seem to increase the risk of cancer. Melatonin directly inhibits the production of these hormones and their reception throughout the organism. In ovarian cancer, the production of estrogens gets out of control, which melatonin can regulate. In breast cancer, melatonin was shown to inhibit the overproduction of estradiol, which induces cell division of breast cells and is a cancer risk factor. In prostatic cancer, testosterone boosts cell growth and activates the spreading of cells within the prostate, which is correlated to cancer development. In addition to its anti-cancer effects, melatonin was found to increase the effectiveness of existing cancer treatments in which supplements are used. In some cases, tumors display resistance to endocrine-related therapies. Melatonin tackles this issue by increasing responsiveness to hormone regulatory treatments. Unresponsiveness to treatment drugs may prevail when light pollution influences the situation and in aged individuals whose melatonin levels are low. The collateral toxicity and lethality of chemo and radiotherapies imply serious concerns regarding their use. The damage to tissues inflicted by chemotherapy is acute and chronic. Melatonin has been shown to mitigate cell damage as well as the toxicity side effects of treatment drugs. The hormone thus may be used successfully in supportive therapy in patients with progressive cancer and for the prevention of toxicity induced by chemotherapy and radiotherapy. Additionally, chemotherapy almost always interferes with sleep rhythms, a problem with which melatonin can help mitigate.
So in conclusion of our findings, I managed to convince everyone how important it is to keep up a healthy sleeping cycle.
Good
Good night!